And we'll just film when we're ready because the noise.
Thank you.
Thanks.
Appreciate it.
Yay!
Thanks.
The noise is gone.
Yay.
Okay. Okay. Whew. Okay.
Okay.
As we were saying,
Oh, are we still taping?
I just left it.
Oh my gosh,
I'm like,
that's
you know
really
what?
funny. I was
Yeah.
like picking my teeth.
Oh, it's okay. It's okay. We did a teeth check. Where were we? Hi, and welcome to Psychology Demystified. I have Meg with me today, who is an amazing psychologist, and I had to rope her in to come and help me talk about this topic. So welcome, Meg.
Thank you. Thanks for having me.
Today we'll be talking about a topic you've been wanting to talk about for a long time, and that is depression. And I'm going to have Meg help me demystify depression so that I can hopefully answer whatever questions you have and hopefully help you see how you can help your families and anyone else you've been wanting to help. As you can tell, today we're outside, so there's going to be a lot of background noise. We're going to try and hope that the video doesn't have too much of it, and hopefully whatever we're trying to say comes through to you despite the noise. So the first thing we're going to start with is, what is depression? As always, I have my trusty notes. I always tell you that I have those. So depression is pretty much low mood that lasts for a long time, and it affects the way you live. At its mildest form, depression is just being in low spirits, and it doesn't stop you leading your normal life, but it makes things harder to do and makes everything seem a lot less worthwhile. In its most severe form, though, depression can be life-threatening and sometimes can lead to suicide. Low mood and depression are a little similar but also very different at the same time. Low mood is something we all go through. Low mood is where you feel sad or miserable about life, but then the difference is that these feelings pass in due course. However, with depression, it lasts longer and it interferes with your life. This could go on for days or even months at a time, not like low mood, which is passing, and that could be a sign that you're experiencing depression. Psychologists can't know whether you're depressed just by looking at you. We can't tell. We can have an idea when we're speaking to you whether you are, but to be absolutely certain that we're going to treat you for depression and give you a differential diagnosis of it, we do tests. One of the most common tests is the BDI, and what it helps to do is that it helps determine what your level of depression is. But that's not the only one. Meg, there's one you also use. What is that?
I will use this iBird test, and so it's often used for children and adolescents, and I like it because you're looking at different behaviors, but you're also there's a secondary measure of how does that get in the way of your life. Sort of what you said earlier, I like that word of kind of interrupting or interfering with your life. So it's not just about the intensity of it, but how does that interfere with your day-to-day, living?
Yeah. So tests, of course, vary depending on age.
Yeah,
Don't they?
right.
Yeah.
Although we'll use the BDI. I'll use the BDI with kids from 11 years old and up.
Yeah.
And I should say the BDI is available online. So you can certainly do it if you want to have a sense of how you're feeling, and then maybe that tells you, should I be calling someone? Because there's an open source to tell you even how to score it. So it's called the Beck Depression Inventory.
Okay,
Yeah.
That's true. But we ask you to use it with caution.
Yes.
Because it's not something you start giving your friends to check if they are,
Definitely
or checking if your
no,
mother-in-law
right.
is. This is not
Right.
what it's for.
It's not during dinner conversation.
No, it's not. It's not. You don't go evaluating all your friends, because at the end of the day, it still has to be looked at by someone who can interpret the score accurately.
Right.
So yes, it's out there, but when you go and see a psychologist, it's not a test that you're supposed to pass. So don't study it.
Right.
Because some people might study it thinking they have to pass this test, but that's not what it is. It's just to help you and to see what level of depression you have, because there are three forms. There's mild, there's moderate, and there's severe. All of them have different treatments. And what I mean by mild, moderate, or severe is that it describes the impact that these symptoms are having on your life. And then because of that impact, then we treat it differently. That's the only reason we do the test. It's not something you have to pass.
Yes, right.
Yeah.
And it helps you, it sort of helps you actually figure out, oh, actually, I am feeling this way because this is moderate or severe. And in some ways, it actually helps you with that information. Helps you, I think.
Yeah, I think so. Yeah. What are the signs and symptoms of depression? After someone who knows how to interpret the test has checked, there are many signs and symptoms, but there are some that are common. So I'm going to talk about how you might feel, and then Meg will jump in and talk about how you might behave. You might feel down, you might feel upset, or you might feel like you just want to cry all the time. Restless, agitated, and just generally horrible is another way. Guilty. Sometimes you don't know why you're feeling guilty, but you're just feeling guilty. You feel down on yourself. You feel like nothing you do is any good. Sometimes you might start to isolate from people, and you're unable to explain why you're feeling like you don't want to hang out with them. No confidence, no self-esteem might be another one. Hopeless and despairing, and then when depression is severe, you might feel suicidal. Now that I've talked about how you might feel, Meg's going to talk about how you might behave when you're depressed.
Yeah, so I think the behavior is kind of obviously a manifestation of the feeling, and you talked about one of the biggest ones, which is withdrawal and isolation. So taking yourself out of social situations and also finding yourself not enjoying the same things that you used to. You might find yourself using substances more, like drinking, drugs. Obviously, that's something to really be careful of, and for loved ones, being really mindful of that one. And you might find yourself less interested in intimacy and sex and romance, and you might stop eating. People start losing weight, or they put on more weight. A lot of people think of depression as gaining weight, but also be careful of being less interested in eating. In children, I just want to say sometimes depression looks like anger or acting out. So just thinking that kids you're only going to see them withdrawn and sad is not just the only way that kids express depression. Sometimes they get really disorganized. So if your child is doing all their homework and just not bringing it in because they just don't have energy, those kinds of things. Even at work, you find yourself doing 90% of something and just dropping off. That may be a sign that something else deeper is going on. Yeah, I would add, I think this idea of losing interest in things that you used to be interested in, I think that's sometimes a sign that something's not right, where you find yourself withdrawing more. I think that's another kind of thing to be looking for going on.
Oh, cool. She covered it all. Told you Meg was awesome. What are the causes of depression? There are a number of causes, and these vary a lot between different people. We're going to go through a list of some of them. We're not going to mention maybe all of them that exist. We're going to go through a list of some of them and shortly and briefly explain what some of them are. So the first one to start with is childhood experiences.
Yeah, I think it's a really important one because obviously our childhood experiences inform the way we see the world. And so if our childhoods were not safe or they were scary, maybe there wasn't one person who was taking care of you, it's very likely that your brain wiring is more prone to depression because you haven't had a chance to sort of process those experiences and realize that the world can be a safe place and you can trust others. And so if you obviously don't have those experiences, you start to doubt yourself and the world, and that leads to depressive symptoms. Yeah.
The second one would be life events.
Yeah.
Life events can cause depression, especially when they're triggered by unwelcome, stressful, or traumatic events, such as losing your job or unemployment, bereavement, when someone passes away, the end of a relationship sometimes can cause depression, depending on how invested you were in it. A major life change, sometimes even getting married, can cause depression. I know it sounds interesting that it does, but sometimes it does. So a major life change like moving, getting married, changing your job, that could cause depression. Being physically or sexually assaulted definitely could cause depression. And of course, being bullied or abused. And that happens even in adulthood. So whether it's a child or an adult, that could cause depression. What's another one?
Well, I think just even thinking about general kind of genetics. So it might be that your family is more prone to depression. Maybe someone in your extended family has depression, and we know that there is a genetic aspect of depression. So if you know or suspect that a family member has depression and you're not feeling right, that might be something to look deeper into.
That's true. Yeah. Sometimes other mental health problems could cause depression. And when I talk about them, it's not actually the issue that causes the depression. It's having to cope with the symptoms of it that could cause depression. And when I talk about other mental health problems, I mean things like bipolar, schizophrenia, anxiety, PTSD, post-traumatic stress disorder, or post-traumatic stress syndrome, and also sometimes eating problems can also cause depression.
Yeah, and again, just to bring it back to adolescents and children, ADHD can cause depression because you're constantly feeling like you're not doing well. You're never meeting the expectations of school or parents or whomever. And we really see depression as a common, what we call comorbid symptom when kids have attention deficit hyperactivity disorder.
Very true. I'm glad you brought that one up because that one's big. That one is. Physical health problems.
Right, like sort of chronic disease.
A chronic disease that could cause depression because you're thinking, it's a point when you're thinking, why me? Why is this happening? Am I ever going to deal with this? What do I do next? So that happens as well. What else? Low blood sugar, sugar problems, anything that I guess is a persistent disease could cause depression.
Or it almost feels like that's all your life becomes is making yourself healthy and not getting anywhere.
Very true. Yeah. Sometimes medication causes depression, and recreational drugs, of course, and alcohol.
Absolutely.
Because with medication, I think it's always important to look at the side effects of medication. And if you think that your medication is causing depression, please speak to your doctor and see how maybe you can change to another one, because sometimes you never know. Everyone's body is made differently. It may cause depression for me and not cause depression for Meg. And we're taking the same medication. So just look into that and see.
Yeah. I think another thing to think about, while sort of lack of sleep isn't going to cause deep clinical depression, things like sleep, exercise, and diet are so incredibly important. And if you are prone to any of these other things and you're not taking care of your well-being, it will heighten your depression, and sometimes it will mirror depression, clinical depression symptoms. So, 8 hours of sleep is incredibly important, and regular exercise 3 to 4 times a week, and healthy, well-balanced diet with some joy in there too.
Yes, true. Yeah. Especially when we hear exercise, we're like, oh, come on. But yes.
Get out there and move. Even 30 minutes of walking a day is
makes a difference.
Yeah, it makes such a big difference.
It does. What can I do to help myself if I am depressed? We're going to talk about a few of them. Talk to someone you trust. It might feel hard to start talking to someone because you don't think they're going to understand. But the first thing you need to do is just try. Find someone who you can talk to about other things, and then hope that they'll be able to understand where you're coming from. And if they don't, make them understand, because no one knows better than you what shoes you're in. Right? Yeah. Anything to add to that one?
I think if you see an opening, if someone asks how you're doing, I think it's okay to be honest and say, actually, it's been kind of rough.
Yeah.
And I think it's all about timing too. So if you sense that someone's in a rush, or you don't have the time, maybe don't delve into the conversation, because that can be very frustrating.
It can.
So choose a good time to broach it with someone. Let someone know maybe that you need to talk. Yeah,
that's a good one. The other one is try peer support. You might, and this one might be a bit hard if you don't have any guidance, but sometimes finding someone who's going through the same thing you are makes it not seem so overwhelming. So peer support does help sometimes, because then you have someone who knows what you're going through, and you're talking about it, and you're talking about how you're dealing with it, and sometimes that works.
I've found in usually my first session, people will ask about how severe, or how, I guess they're just trying to get an understanding of how they fit into this larger world of maybe having some struggles. And when you tell them that actually there's people you've worked with that have more severe symptoms, it really does. I think it's very helpful to know kind of where you are, and that there's people that actually struggle a little more than you, and there's people who struggle just like you, and that connecting with them is really useful. Yeah. And people have great strategies.
Yeah, they do. Yeah. They do. Another one is mindfulness. I know this is new to a lot of people, and it might sound very new age to some of you, but mindfulness is a way of giving your full attention to where you are at the present time. And you don't even have to really know how to get into it. If you look on YouTube for adults, you will find that there are so many people who've done mindfulness videos.
Yeah.
Find a voice that soothes you and listen to all the steps that they're going through. It's all about breathing, bringing yourself into the present. And there are others also for kids. There's a
Yeah.
Mind Yeti as well, Mind Yeti. I'll put all of them in the description box, so don't worry about writing them down or memorizing them. And there's an amazing one that you were talking about. What's it called? Yeah.
So
yeah.
there's John Kabat-Zinn.
Yeah.
He's got a couple of great books. He's got videos, and again, it'll be in the end resources. I think it's he's just sort of explains also the brain science behind that. So if you're one of those people who wants to understand
Yeah.
why mindfulness works, I would definitely get into that and understand also how stress and depression affect our physical health. I would also suggest looking at Headspace. It's an app you can get, and you can kind of get short mindfulness exercises,
Yeah.
even 2 minutes a couple times a day, just helping you pay attention to where you are in the present moment. And do that with kids too. Again,
Kids love
it.
They do love
yeah.
it. It can be a family thing. It
Yeah.
could be a thing you do on weekends or in the morning or at night before going to bed.
Yeah.
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 It's
And there's
great.
plenty on YouTube.
Yeah.
Yeah.
So many resources. Just find a voice that soothes you and then go with that.
Yeah.
Right?
Yeah.
Looking after your physical health. I know we mentioned that before, but then the things to do are, of course, trying to get a good night's sleep, thinking about your diet, which Meg mentioned, trying to do some physical activity, and you also mentioned that. What's another? Trying to look after your hygiene. If you're feeling depressed, there's some days you don't want to get out of bed.
Yeah.
And you don't want to shower. And you want to stay in your pajamas all day. But just getting out, taking a shower, dressing up, even if you're not going anywhere, sometimes that boosts your mood, doesn't
Yeah.
it?
Get out of your comfy clothes.
Yes, yes. I know they're comfy, and I know we can stay in them all weekend,
Yeah.
but yeah, it helps.
It
It really
does
does boost your mood in some way. It does.
Yeah. Plenty of water too, and again,
Yes.
a glass of wine, of course, or here and there. But in keeping an eye on the substances that you're having, it really does affect both anxiety level and depression levels.
It does. Try and avoid recreational drugs and alcohol, because especially if you're feeling like you are depressed, because you think that in the moment they're going to make you feel so much better, but there's a down,
Yeah.
there's a high, and then there's a crash.
Yeah.
So the high is really good, and then the crash just makes you feel even worse in the end. So that's
Yes.
not an option.
And if you are taking medication for depression, absolutely, it's a no-no to be drinking and using drugs, because it just really messes with your brain
It does.
chemistry.
That's
Yeah.
so true. I even forgot to mention that. Of course, trying to keep active, keeping a mood diary sometimes helps. And this is a diary that only you get to see.
Yeah.
So it's your mood diary. Spending time outside. I mean, we live in Kenya. There's Karura
lucky.
Forest where you can just walk by yourself. You know, those are really good mood boosters,
Yeah.
I would say.
Yeah.
Yeah. And then, of course, practicing self-care, which means do your hair. Go have your nails done. Book a massage. Not in your house, because you're trying to get out of the house.
yeah.
So just go book a massage. That means you don't have to talk to anyone. You just, get a massage. It's quiet. You don't have to talk to anyone. You just go in, get the massage, and go back home. At least you've left the house.
Yeah.
Anything else I forgot?
I think, be comfortable saying no and without apologizing. I think just in general, stop apologizing. We'll apologize for so many things. But if you are overextended, it's okay to say no.
Yeah.
I'm sorry, I can't do it this time. Or, nope,
Yeah.
it just doesn't work right now.
Yeah.
I think that's okay.
I like that one.
Yeah.
Yeah. So you're probably wondering what the treatments for depression are. We're going to go first with the talking treatments. Talking treatments are where we do something called cognitive behavioral therapy. This one is where we... How do you explain it to make it seem... Go, help.
Well, so in cognitive behavioral therapy, a lot of times you're looking at what are the thoughts that are contributing to the behavior. So if you are withdrawing, or you're not, you're just not yourself, there's probably some thoughts that are actually interfering
Yeah.
with your behavior. So a lot of it is sort of studying what are you telling yourself, what are you saying inside that affects both your mood and what you're doing. Like, it's not going to make a difference if I get out of bed, or I'm no good at my job. If you keep playing those tapes, of course you are going to start to fulfill those thoughts.
That's
So
true.
part of it is just studying them and interrupting those thoughts.
Yeah. So with CBT, what we do is have you become aware of it, recognize when you're having those thoughts, and then we teach you how to replace them
Yeah.
with more positive thoughts that allow you to live your life. Group-based cognitive behavioral therapy, where we put you in a group and you have group therapy. You don't have to know too much about them. You can look them up, of course, but your therapist is the one who's going to do all of these. So yeah, look them up to know what they are, but we're the ones who will decide what's the best course of treatment for you based on the assessment that we did on you. So it's a group as well.
I think in a word about therapy is that we're, that you're not going to be forced to sit on a couch or lay on a couch and be analyzed and discuss every aspect of your childhood and life. Of course, sometimes that's useful, but really try to find someone who makes you feel comfortable. And we're trained to not have a judgmental stance and to listen openly.
Sure.
But you do have to feel like the person that you've picked is someone that you can really be comfortable and vulnerable with. Yeah,
very true.
Yeah.
Very true. Speaking of the couch, a lot of people do believe that you go and lie down and no. I always wanted that. I thought that as a kid. I thought it as a kid, but then I discovered that you don't, and I was like, man, I know. Yeah, no couch. The couch is for sitting on.
Yeah.
We just
Yeah. I mean, there is our couches in the office.
But you don't lie down. No, you don't. Behavioral activation is another one. You can look that up. Don't worry about what they mean. We're the ones who will do that for you. We just want you to know what they are. Interpersonal therapy, or IPT, is another one. That's a talking treatment. Psychodynamic psychotherapy is another one that we do. And then behavioral couples therapy, because sometimes couples are the ones who need, especially when we talked about how sometimes marriage can cause depression. So behavioral couples therapy works for couples.
Yeah, and family therapy is really useful, especially for adolescents or even people in their 20s while they're trying to understand what their role is going to be as an adult. Sometimes it's useful to sit with their parents and really understand, for the parents to understand how they're doing, but also for the patient and client to understand their parents' perspective and maybe what resources there might be for them.
That's a good one, yeah. Another one that I'm going to go into was the second one, which was medication. Sometimes medication is necessary. Especially when talk therapy hasn't fully worked. Sometimes medication becomes the next step. Usually it's the last phase for you as well, right?
Yeah,
usually,
sometimes, but usually if you're doing both at the same time, it's really good. It's probably best.
It is. And usually by this time, you have a team working with you because a psychiatrist has prescribed it. So the psychiatrist and psychologists are working together just for you.
Yeah.
And some of the things that some of the medications out there are, and I know this is just going to be a bunch of words to some of you, but we'll just mention them so you have an idea. There are SSRIs, or if you want the actual word, selective serotonin reuptake inhibitors. Yes. Another one is SNRIs.
I don't know that.
MAOIs as well. Other antidepressants, and of course there are also tricyclics and tricyclic related drugs. Lots of words, you don't have to know them, but when you hear them, you will be totally surprised and think, what? So those are antidepressants that exist out there.
Yeah, and people like us don't prescribe them, so we have no vested interest other than people getting better and feeling better.
Yeah.
But we have seen, time and time again, that just starting a medication will help people feel like they can get out of bed or feel like they can get back to work or whatever it is.
Exactly.
So,
Exactly. Awesome. Now, if medication has been prescribed for you, I know you're wondering whether you can come off medication. If you're taking medication for depression, it's important to not suddenly stop taking it. It could have a huge impact on you because then you might experience withdrawal symptoms from the antidepressants that you were taking. So please don't suddenly stop. Just because you're feeling better, don't think, yeah, I'm good, let me just stop. That could be detrimental to your health.
Absolutely. Yeah. And make sure that someone in your life knows that you're taking medication outside of your doctor and your care team.
Sure.
Because first of all, they can kind of keep an eye on side effects that you may not notice, but also they can help you stay consistent.
Yeah.
If you do need reminders, or if you really do want to go off, they can kind of be your coach and your cheerleader to just stay on it until you see your psychiatrist.
Yes.
And normally you'll meet with the psychiatrist once every month or two. So they're going to be keeping an eye on you as well.
Yeah. Very true.
Yeah.
There's another treatment that I hadn't mentioned and hadn't talked about, and that's alternative therapies, because sometimes there are alternative therapists out there who use different types of treatments. And some of them are arts therapies. And what are others? You're really good at this one.
So I think I practice a lot of expressive therapies like art and something called sand tray, and even play therapy, which actually we certainly use with parents as well to teach parents how kids play. But I think it's really helpful to sort of make your internal world kind of somewhat outside, external, I guess, so that you have a better sense of how you feel and what it looks like to feel that way, so other people in your life can see that too. So I think the expressive therapies, if you like art therapy or you're artistically minded or creative, I think it's great to have this process of getting again how you might feel out to the outside world. And music therapy is really useful as well.
Yeah, that's true.
Because we all apparently have like an internal rhythm, and it's really great to be able to express yourself in these unconventional ways, because some of us aren't really talkers, and some of us really would rather not spend 50 minutes speaking. So definitely look into if your provider would do something beyond just talk therapy, because it can be really useful.
That's true. Very true. I like that one.
Yeah, and there's all kinds of other things like equine therapy and I guess like sort of like this adventure therapy. There's lots of really neat things out there to look into.
Yeah. Lots of therapy. Lots. If you look up types of therapy, you're gonna get a whole list. And we don't do all. I've mentioned in other videos, we don't do all of them. So, but there are therapists out there who do. We share the load. That's what we do.
Yeah,
Yes, we
that's
share
right.
the load. Yeah. Now, we've talked about how you can help yourself, but then I'm sure friends and family want to know how they can help. So how can friends and family help? Well, support the person who is going through depression to get help.
Yeah.
One thing you have to know is that you cannot force anyone to seek help. They have to be willing to go on their own.
Yeah.
But it's important to reassure your loved one that it's okay to ask for help, and then see if you can slowly and gently try and convince them to then seek therapy. But please don't surprise them with therapy. Don't just drive them up to a therapist's office and say, here we are.
Yeah.
Don't do any interventions at home, because some families do that, and that surprises someone and they feel ambushed, and then having that talk just doesn't work. They need to feel your support first before you start seeking help.
Yeah, I mean, even just letting them know how you think they may feel, like that sounds really devastating.
Yeah.
Sort of letting your family member or friend know that you can hear them, and you're not going to try to fix them immediately.
Yeah.
That you can first kind of sit with how uncomfortable they've been feeling.
Yeah, exactly. And then how else can you help? Be open about depression. Lots of people find it hard to talk about depression, and it's this secret subject and something that people don't talk about. But let your family member or friend know that it's okay to speak up. Listen without judgment on your face. Just let them know that it's okay to feel what they're feeling. Let them know that their experiences are their experiences, and that you are respectful of them. What else can you do?
Yeah, I think validating them,
Yeah.
and if people have a practice of maybe it's exercise or meditation or their faith, and it might be that that's not enough, still encourage them to do those things,
Yeah.
but also you might encourage them to maybe be curious about what else could be done, because maybe these things aren't enough.
Yeah. And just be prepared for difficult emotions coming up. Yeah, so just be prepared for that and just sit there. Even if you don't know what to do, just sitting beside someone makes a huge difference. You don't have to always know what to say. Just your presence makes a difference.
Yes. We have this saying, it says, don't just do something, stand there. So if you can stay in touch and be present and active, and also just don't feel like you have to fix or say the perfect thing. Yeah, I think that's so important.
We mentioned before that someone who might be experiencing depression might isolate themselves. Keep in touch, seek them out. It's tiring. Yes, it takes a lot of energy, because then you feel like you're doing most of the work, but that's what they need at a particular time. So keep in touch. Just text message them, email them. If you're not going to see them, a phone call. Sometimes they might not pick up the phone. but just a text message. They'll read it. Maybe they won't respond, and don't take that personally. But just keep reaching out. Just keep reaching out, even if it doesn't seem like you're making a difference.
Unless and until, the one exception is if the amount that you're supporting and caretaking is becoming problematic for you. And you'll know that because you'll start to feel resentful or angry. So you do have to kind of watch yourself too, right? So that you're taking care of yourself and keeping your own boundaries.
Exactly.
And that's not helping someone else if you're kind of fixing all their problems.
So true. Another thing is, please don't be critical of them. If you've not experienced depression, you don't know how it actually feels. So try hard to understand that your family member or your friend cannot just snap out of it.
Right. And they're not lazy.
No, they cannot. Yeah, because a lot of people say snap out of it. It's if they could snap out of it, they would. It's not a fun place to be.
Yeah.
So, and that's the one that's always the biggest one, where they're always told, I want you to talk to someone, but I was told snap out of it, or to be a man, or to
calm down.
Yeah. Yes.
If it were only that easy, right?
Yeah. If I could calm down, I would calm down. Do you think I like feeling this way? So yeah, please, just hold it. You think it in your head, but don't say it. Yeah. If you want to think it, that's fine. We won't stop you, but please don't say it, because you're actually not helping the situation. And remember, the person who's feeling this way is already judging themselves. They're already critical of themselves. They already feel like they're less than. So your words just make them feel even more so.
Yeah.
So it really doesn't help. And as Meg said, at the end of the day, take care of yourself. Keep a balance. Don't try to overdo things for someone who's feeling depressed, because if you can't look after someone else, if you can't look after yourself. Right. Should I stop therapy if I start feeling better? What would you say?
Well, I always say if you're feeling better, it's probably because something's working.
Yes.
So let's keep going, right?
Yes. Yeah. But you have to see it to the finish line, and that means that you just keep going. Yeah, don't assume that, okay, and now I've got this, I can handle this, because maybe you don't fully have the coping mechanisms all in place yet. And because you've been receiving the help and you don't realize you've been receiving the help, and that's why you're feeling better, you might think, yeah, I've got this, I've got a handle on this. And then you discover that you don't. So no, don't stop therapy. Yeah.
And don't stop it when it gets hard, because sometimes it often gets worse before it gets better.
That's true.
And that's really common. So if you are thinking about going down this path, know that it is very brave, and that it may get a little bit worse, and it gets better. I've seen that. I'm sure you have too.
Yeah, exactly. And as we're also saying, when it gets better, then come and talk about all the things that you're doing well.
Yeah.
Come and tell us. Let's celebrate with you. Let's see how we can keep them that way. So no, don't stop, because we will be with you when you're feeling down. We'll be with you when you're experiencing your great moments. So yeah, so just keep coming. Just keep coming to therapy. And that wraps up our segment on depression. And it's important to know that some people might wonder, after all of this, what if I don't feel any better? Well, it's important to remember the recovery is a journey. It's not a race, and it won't always be straightforward. As Meg mentioned, there are going to be ups and downs. There'll be good days, there'll be bad days. You might find it more helpful to focus on learning more about yourself, developing ways to make things better for you, and rather than trying to get rid of all the symptoms of depression, because it's one step at a time.
Yeah. Sometimes if depression's been there for a couple of years, we can't expect that in a month it's going to be gone. So be gentle with yourself.
Yes, it's not a quick fix. Yeah. All right.
Take care.
Thank you so much for joining us. If you have any questions, please feel free to comment down below. And thank you so much, Meg. This is awesome. It was so awesome. And in the future, we'll be covering something else you've wanted to know about. If you want to know, keep watching. Bye.